Thank you very much for joining us, Linda-Gail, here on NewsLink on ENCA. We're seeing the surge continue with the Western Cape and KwaZulu-Natal, but when Gauteng got into the grips of the third wave and it was confirmed that Gauteng is where it's all starting, it was said that the Western Cape would eventually get to the point that Gauteng was once at. Is that what we're seeing now, or is there something else that is the cause of the surge down there?
No, I think this probably is our turn for this third surge in the epidemic, and I think it's a little delayed compared to Gauteng, but is exactly part of that third surge. I think it's just that we're in a different province and it's happening a little later.
The numbers when things were really bad in this province were double what the Western Cape is going through right now, and sometimes even more. Are we expecting the Western Cape to get worse, or is this where it's at in terms of its peak?
You know, I'm not one of those individuals who likes to predict what this virus is doing. I think it is on a track of its own, and I think what we have to just continue to do is take all the precautions, all the preventive measures we can, and plan for the best, have the contingencies in place, and watch and wait. I think that's the best way forward. But yes, I think if we see what happened in Gauteng, then I would imagine that very soon, hopefully, we'll see ourselves peaking here in the Western Cape and in KwaZulu. I think that certainly would follow the pattern that we've seen in the first and the second wave, at least.
I'd like to believe that the health departments in the Western Cape and KwaZulu-Natal expected this and were preparing for it as they saw what Gauteng was going through. Do you feel like the right things have been done in terms of making sure that the people of the Western Cape and KwaZulu-Natal are protected from this third wave a little better than what Gauteng went through?
Yeah, I mean, I think, we have limited armamentarium, I suppose, against the virus. We know what we have to do, and I believe that, provincial governments as well as the national government has continued to promote the NPIs, the non-pharmaceutical interventions that everybody is being asked to practice. Of course, vaccination is our other great armor here. And as we all know, we've had a constricted supply. I'm very aware here in the Western Cape, every single dose that's arrived has been used up as quickly as possible. The province has been opening up new sites. So the effort to at least get as many people vaccinated as possible has certainly been carried out. I think that is the next big task for us across the country, is to make sure those vaccines continue to come into country and continue to get into arms as quickly as possible.
It's encouraging that you say that the doses that keep coming into the Western Cape are being used, because there have been cries in other provinces. I know in Gauteng, for example, the MEC of Education, Panyaza Lesufi, went for his jab, and he posted a picture of how empty the vaccination site was, and that people were calling for there to be vaccination sites open on the weekend, but there are no people going in, especially now that we're in the 35 to 49 group. Talk to me about the hesitancy in this country, because there seemingly isn't much hesitancy in the Western Cape, but just in general in this country, and how it's stifling the rollout.
Yeah, I think there are pockets of anxiety in particular groups, in particular age groups, and populations, and definitely we need to counter that with good information. There's also, of course, the sort of anti-vax drive, which fuels that. But it's very important that South Africans realize, along with individuals around the world, that this is a legitimate and very effective way to prevent severe disease and death. It has been shown now in whole countries that where individuals have been vaccinated, we see a huge reduction in severe disease and death in those individuals. And the individuals that are now, coming into ICUs, filling the hospitals with really severe COVID are mostly the individuals who've not yet been able to be vaccinated. Now, in this country, we've been set back in that we've not been able to get our vaccine rollout going as quickly as it has happened in North America, in Europe. We've got catch up to do. And, you know, what we cannot afford is that individuals are not stepping forward when they have the opportunity, really for their own sakes. This is my message, is if you do it for no other reason, do it for your own benefit, your own good health. You know, the analogy I would show here is that as parents, we take our children in to be vaccinated because we know that measles, for instance, could cause severe disease and even death in our children. And we do that willy-nilly and with, you know, with confidence. This is a virus that doesn't as much attack children as older people and people with comorbidities. So if you are an adult, particularly if you're in the older age group or you have comorbidities, particularly then, you need to make sure you go and get vaccinated in order to give yourself the best chance in the face of this virus.
Just very quickly, Linda-Gail, time is against us. The 18-plus group is begging the health department to open up vaccination a little earlier than what they have proposed, which is the 1st of September. Would you agree? Because, you know, there are doctors even that I know who've gone onto social media, for example, calling for open the EVDS for those that really want to vaccinate. So 18 plus are there, ready and waiting, jealous of those who've been able to. Do you feel like there shouldn't be a time bound? Just open it up and let those who want to vaccinate, vaccinate.
I would say that in those places where we are seeing vaccine hesitancy in such a way that our centers are not filled with individuals wanting to be vaccinated, then we should open up to anybody who wants to. I understand the reason for prioritizing before. We wanted to make sure that those individuals who were most vulnerable got first dibs. But now, you know, if indeed those queues are beginning to dwindle, I would say it should be open to all. I agree.
Linda, thank you very much for joining us here on NewsLink on ENCA. Of course, that is Linda-Gail Bekker, who is the Professor of Medicine at the UCT.